Our first speaker today is Dr. Karl Beier, and he practiced medicine in Franklin, Virginia from 1985 to 1999, and then joined Blue Ridge OBGYN here in Culpeper in 1999. With his partner, Dr. Godfrey, he expanded the OBGYN practice in 2004 to include cosmetic laser therapies, and the expansion was so well received that the full-service Med Spa Virginia was established only months later. Dr. Beier specializes in leg vein procedures, cosmetic injectable therapies, and the thread lift at Med Spa Virginia. And now we're lucky to have him here speaking to us about it. Thank you.
There we go. Good afternoon. I want to thank you all for inviting me to come today and speak. As I drove up, I was looking at how well dressed everybody is, especially the hats. I love the hats. I wasn't sure if I was coming to the Kentucky Derby or to a tease. But anyway, you'll have to excuse my scrubs. I'm on call today. I just delivered a baby about an hour ago, and I've got one more mom in labor, and I'm hoping she'll wait till we're done. Otherwise, it's going to be a very fast dash back to the hospital. I was asked to come today to speak about leg veins because that's one of the services we provide at the Med Spa, which is located next to our office on the top floor of the Surgery Center building. You know, most people, when they talk about leg veins, they think about spider veins, which are mainly cosmetic issues. But there's a lot more involved to leg veins than meets the eye. And that's particularly important because a lot of the things that cause problems with your legs are venous disease that is deeper that you cannot see. And most people are very unaware that they actually have a problem with their legs. Typical vein problems include things such as aching in your legs toward the end of the day, especially common in women more than men, and especially common in women who have been in occupations where they stand on their feet for long periods of time. And typically the pain that women have that are due to leg veins are calf pain or lower leg pain. And often it's on the inside of your leg or in the back of your calf, rather than in the front or on the outside. Another very common symptom is people that have had swelling at the end of the day, where their ankles will start to swell as the day goes on. And most people notice that if they're get up in the morning and look at their ankles look fabulous, and then as the day goes on, they look puffier and puffier, and that's very common. Other things that most people don't realize are associated with leg veins is restless leg syndrome, where women have their legs moving around all night long, often disturbing their sleep patterns, often disturbing their partner's sleep patterns. And that's because your veins in your legs, the way the blood gets back to the heart is your leg muscles pumping. And your calf muscle is the heart, so to speak, of your leg. And so when your pressure in your veins gets to a certain point, that muscle starts to reflexively contract to pump the blood out to lower the pressure. And that's why women very often will have their legs moving around at night, because they're actually pumping their leg veins to get the blood away. Other times we will see people who have had ulcers on their legs that don't seem to want to heal. And that's very often due to leg veins problems. And then there are obviously the painful varicose veins that people get as they get older as well. So basically the way that we decide if this is a problem is you go and see your doctor, and we also do this at the Med Spa, where you can come and have an appointment if you're having any of these problems. And pretty much by taking a good history and looking at somebody's legs, you can get a very good idea if they've got underlying vein disease. And then the next step is to evaluate the vein with ultrasound. And we do a type of ultrasound called mapping. And Lewis, who's right here with me today, and I brought him to the front to help answer questions at the end, is our ultrasonographer. He's been doing leg vein ultrasound and treatment for over 25 years. And we use regular ultrasound and we use color flow Doppler. And it's pretty fascinating to watch Lewis at work because he will put the ultrasound probe over a vein, he will squeeze the calf, you will see the blood flow one direction in the vein, and then you'll see it fall back the other direction. The direction is not supposed to go in. And then you know you have a vein problem. And all of these evaluations are done when you're standing because that's when people have the most trouble with their veins. Once we do an ultrasound evaluation, then we can try to figure out what we can do to help somebody. And there are basically 3 different modalities that we use, and then there's one that we refer people to a vein vein physician, basically someone who's been trained to deal in artery and vein disease, to do what used to be the standard treatment, which is varicose vein stripping and ligation. We really don't see that used very much anymore. There are much better ways to deal with this, fortunately, so that you don't have to have surgery, you don't have to have a lot of downtime. The biggest vein in your leg in the superficial system, and you probably don't realize that there are actually 2 systems, a superficial system and a deep system. The superficial one is the one that gives people the most trouble. And the reason for that is because those veins are basically coursing through fat tissue and connective tissue, not really supported by anything. They tend to drain at various points in the legs down into the deep system where those veins are surrounded by muscle. They have very good support and most of the time don't end up having problems. So it's a superficial system that we concentrate on. And the largest vein that gives a problem is called the greater saphenous vein, and it runs down the upper part of your calf, down toward upper part of your thigh, down toward your calf. And the treatment for that large vein is generally one of 2 modalities. One is called endovenous laser treatment, where we actually put a laser fiber up through the vein and then numb the vein all the way around and then gradually withdraw the fiber while we deliver the laser energy to the fiber. And what it does, it heats up the vein and basically damages the vein so that when the vein collapses, the walls stick together and the vein disappears. And so you don't have to actually physically go in and remove the vein, you basically let the body take care of it for you. Once you, quote, kill the vein, the body will come in and dissolve it. And over time it will go away. So that's the other way to treat that is with radio frequency. It's basically done exactly the same way. They put a fiber up inside the vein and use radio frequency instead of laser to deliver energy to injure the vein. And there really are no advantages or disadvantages to either one. The one that I've been trained to use is the laser, and it's been around for a long time. The other thing that we'll do, if the vein is too, we call it tortuous, where it's too twisty to pass a fiber through the vein, is we do a procedure called sclerotherapy. And sclerotherapy of large veins is done under ultrasound guidance, where we actually use the ultrasound to watch the needle go into the vein to make sure the needle's in the vein, and then we inject chemicals. They're called sclerosing agents, and they've been around for 70 years. To, again, damage that vein so that the walls become sticky and stick together and the vein closes off. And then the last thing that we do for more superficial veins that we can see without the need for ultrasound is we just do straight sclerotherapy, where we'll just put a needle in the vein and inject it. If the vein is big, we like to use ultrasound to help us because the sclerosing agents can be damaging to the other tissues. If you don't put it in a vein, you can cause a skin ulcer or skin damage. So in the when we use higher concentrations, we want to make sure we know exactly where we are. For the lower concentrations, it's not so much a problem, and you can do it without the use of ultrasound.